You're live.
Good afternoon, everybody, and welcome to the latest edition of our Share and Learn. This is actually our last Share and Learn in this series. And today we're going to be learning about one of the programmes that are part of the Integrated Care Partnership here in Nottingham City, and that's the programme that's been focusing on reducing inequalities in health outcomes in Black, Asian, minority ethnic communities. My name's Rich Brady. I'm the programme director for the Nottingham City Integrated Care Partnership, and this afternoon I'm delighted to be joined by physically joined by Donna Sherratt, one of the programme leads, and Clive Foster, the other programme lead as well. He's unable to join us today, but Donna and Clive have done a recording for us for this programme. So what we're going to do is we're going to have a presentation which Donna and Clive pre-recorded, which will run for the next sort of 20 minutes or so, and then after that we're going to have a Q&A session, as is usual with our Share and Learn sessions, with Donna at the end of the programme. So I would encourage you to, throughout the next sort of 20 minutes or so, to add your questions in. If you click on the Q&A bar at the top of your screen there, you can add your questions in, and then I can field them to Donna at the end of the session. So without further ado, I'll hand it back over to Daniel, who I think should get the presentation running. See you in 20 minutes.
Hello, so this ICP Share and Learn will be looking at reducing inequalities in health outcomes in BAME communities. So the ICP has a number of priorities, and priority 5 is reducing inequalities in health outcomes in BAME communities. This work stream has been focusing on that, and to a limited extent we're looking to see how we can address this all-important issue. So a summary of the progress that we've made with this work stream. What is it that we're trying to achieve? Ultimately, we're trying to achieve a culturally competent organisation. Whatever your organisation may be, it's important that we understand the importance of health inequalities and better outcomes. So the summary of what took place to achieve this was that we identified programme leads, myself, Clive Foster, and Donna Sherratt, who you'll be hearing from later. We worked collaboratively, the Nottingham Together Board BAME subgroup and the ICP partnership came together and formed what we call the ICP BAME Health Inequalities Group. As part of that work as well, we devised a number of programme objectives. These programme objectives to tackle the health inequalities were co-produced with community leaders and members of the ICP partnership. As a result of that, there was a development of an action plan to meet the objectives. We were very keen to understand that there should be no more as it were, engagement in reports. A number of reports are already out there regarding health inequalities. And we wanted to use those reports and see this work stream not about just doing another report, but actually trying to create something that was going to make some kind of change with regards to better outcomes around health inequalities. So one report we did look at was obviously the BAME Health Needs Assessment report that was done in 2017, and the subsequent health inequality survey that's been done as well more recently. We use these local reports to help us understand what are some of the existing problems regarding health inequalities in our communities. Now, it's really important to say as well that with this work stream, there was a real context behind this that enabled us to, as it were, push forward on this particular work stream. I'm sure we're all aware of the Black Lives Matter protests that were happening, and also the tragic death of George Floyd. These worldwide changes and events that happened really did bring to the surface the aspects of structural racism. And it was in this setting that we understood more widely as a society, and indeed more globally, the dangers of structural inequality and systemic racism. And you would recall that a number of organizations committed to wanting to address the issue of structural racism as a result of the death of George Floyd and the Black Lives Matter protest. Also, we did see as well, even as a result of COVID, that this showed us as well some of the inequalities that was happening with regards to how people were being getting treatment and service during the COVID pandemic. We recognized that there were a number of people from the minority groups who were being disproportionately affected as a result of COVID. Indeed, the government commissioned its own report to look into this. And so we see that even during the COVID pandemic, health inequality was a factor. What was really important is that the ICP had the good foresight to make health inequalities a priority. So with that in mind, it enabled this work stream to have the impetus to take this work forward. So the good foresight of the ICP already making health inequalities a priority, and the subsequent context that we found ourselves in with the Black Lives Matter and the George Floyd death, and the, as it were, national and worldwide commitment to addressing structural racism, gave impetus to this work in tackling health inequality issues. Hence, the ICP steering group was established, and we set out with a bit of a mantra as a result of this, saying, if not you, who? If not now, when? Recognizing the sense of urgency and the need for change, and recognizing that we just have to come to terms that the structural racism, discrimination has been around for centuries, for years, and the change that we want to see is not going to happen overnight. It does require an approach which we would call a forever journey. So it's really important to understand the, in this particular program, the kind of objectives that we were looking to work with and the changes that we wanted to see around structural racism. We established the formal governance of the group, the BAME subgroup, and we devised a timetable of when those meetings would take place. And the group, together with the ICP partners, we came up with three main objectives that we would be addressing. Number one was to review the commissioning processes to address any structural racism, strengthening engagement and involvement of the BAME communities. This is really important. Sometimes the very first area where we need to be addressing inequality is in this commissioning process, and we need to be looking at that. The second objective was understanding the contribution of the community organisations in the commissioning of services. To meet the health and wellbeing needs of BAME communities, it's really important that there are a number of organisations within the BAME community who bring their own, as it were, expertise and insight, and it's important that we look at that in terms of their usage when we're addressing health inequalities. And thirdly, understanding that we needed to transform the engagement and the communication with BAME communities so that we could improve the access to and the experience of the services that were being used regarding health. These were the three programme objectives that we sought to get our teeth into when we were looking at this particular stream of work. Now, there was a number of stakeholders, and the approach that we took was very much of co-production. So who was involved? We had 8 community and voluntary organisations and 8 ICP partners, and you can see some of the acronyms on there. We'll come on to who was involved a little bit later. How did we do this? So we also had a number of one-to-one meetings with the ICP and community partners. We recognise that when you're addressing an issue such as this, it wasn't just in the meeting itself, but also in subsequent one-to-one meetings, that you can get further insight in tackling the issues and understanding from the perspective of ICP partners and also from community groups what are the issues that they are facing with. It's really important to stress here as well that one of the reasons we were able to make some progress on this was because of the senior representation of the ICP partners around the table alongside with community organisation. So how we did it as well, obviously we used the BAME subgroup to tackle some of the issues and fine-tune with the area that we were looking at. And there was a general knowledge exchange, research and exchange of good practice that enabled us to start to craft the steps that we needed to be taken to address the issues that we were looking at. And I would have to say that the impact was there was an appreciation and respect for in the different domains and disciplines that the community and the ICP partnership was bringing. And there was a great sense of creating a solution in partnership to address this issue as well. So a little bit more about the stakeholders in this co-production work. And it's really important to stress co-production. These are seen as equal partners at the table at the beginning in the design development of the actual process to address health inequalities. So from the ICP partners, as you can see there, we had the Nottingham City Care Partnership, Nottingham City Council, Framework Housing Association, and the Nottingham Community and Voluntary Services Health Watch, and the Healthcare and NHS Foundation Trust as well, and Nottingham University Hospitals, and the Nottinghamshire Clinical Commissioning Group. These representations were really important to give their insight, knowledge, and breadth, and participation in co-producing our process to tackle the inequalities around health. From the community organisations, we had a range of different communities. We had the Nottingham Counselling Service. A number of faith representations were there. Really important in this particular piece of work stream that we had institutional representation, and it was important that we had organisations from these institutions. So you can see there we had the Nottingham Council of Mosques, we had the Nottingham Majority Black-led Churches, Nottingham Muslim Women's Network, Al-Hurriya, Signpost to Polish Success as well. This shows also the diversity of communities that were present to engage in the stakeholder and co-production work. And there were other representatives and individuals who as it were, straddle, as it were, both areas in terms of their community and their health expertise, persons like Maria Ward and Rose Thompson. And with these partners and communities and ICP representations, we was able to design a toolkit to lead us into the next stage of the work. And I'll hand over to Donna, who can explain more on this.
Thanks, Clive. So Clive set the scene there in terms of what a emotive, cross-cutting challenge that we had with this work. So we wanted something that was going to enable the change, and we knew, as Clive said, that we needed to speak to different people about what that might look like. So we had one-to-one meetings with the ICP partners, and also lots of different discussions. And what we identified were two key themes. One of them was that everybody acknowledged that this was such a big agenda, it's potentially overwhelming and we could lose focus. And also that historically there's been lots of documentations, approaches and processes, and we didn't want to repeat and continue in that cycle of trying to explore what the problem was and not getting to the point where we can affect some of the change. So we wanted to move beyond the challenge. The workstream leads, myself and Clive, we recognised that from that feedback, what we needed was asset-based, something that was asset-based. It needed to be empowering, achievable, and also provide that equal voice of engagement from ICP partners and also community groups as well. and that we would be able to share the learning that would influence those around the table, but also the system wider as well. Next slide, please. So we needed something that would enable us to make all of those things happen, and acknowledge that we're talking about lots of different organisations in lots of different spaces, and we wanted it to be strengths-based. So we looked at different strategies as to how this could be achieved. This included looking at whether we would focus on the JSNA, whether we would look at a specific BAME community, or that a particular ICP theme, or maybe a health inequality. We came to the conclusion that if we were to use a maturity matrix model, that this would enable it to reach across ICP partners, commissioners, providers. It would be strengths-based because it's all based on an assessment from where you're at. And also it would allow you to move at different paces within that. And that's why, as I say, we chose to use a maturity matrix and to focus specifically on the objective around reviewing commissioning processes to address structural racism, strengthening engagement, involvement within the BAME communities. Next slide, please, Clive. So implementing the change. So we needed to find the focus for the maturity matrix. We'd seen lots of different matrix which were off the shelf, but we recognised, as Clive described earlier, it needed to be co-produced. It needed to be Nottingham based and owned by the people who would be driving it forward. And as part of developing that, we acknowledged that the maturity matrix needed to focus on creating culturally competent organisations. So we had a plan around this. As I say, it was to have a maturity matrix, be co-produced, and in collaboration with individuals from the community and also community organisations as well. We acknowledged that we would need to test it out across organisations with different projects or ICP leads to make sure that it was fit for purpose and scalable. And that from that we would have action plans that organisations would be able to use, and that's where we would see the change and the effect of that change. And then the ICP steering group would develop into a place where good practice was shared, and we would be able to address challenges and seek opportunities to learn across the ICP. So if we go to the next slide, please, Clive. To enable all of that to happen, we acknowledged that we needed something that would that it was the right time to do it for different purposes regarding enablers. So we needed lots of different people involved so that we had divergent thinking, inclusive communication and collaboration, that we were going to have culturally mature conversations. Another enabling factor was that it's cause-led, as Clive said already, if not you, who, and if not now, when. We're also lucky in terms of the amount of strong evidence that's been built. So one of the things, the Race Observatory is being developed and helping to set some of the vision, and we can see lots of different things happening locally in terms of the res data, different groups that are happening to support this agenda. So they're all enablers to help all ICP partners and community organisations to help us to develop and move this work forward. There's established governance and strategic commitments, and also there is the funding streams that are becoming available, and we've seen that the ripple effect of that across Nottingham. And importantly, also an increasing number of tools and resources are becoming available, and the conversations and the networks and the commitments that people are making are all helping to enable this work to be forever lasting and a continuing journey. So if we just go to the next slide, please, Clive. So here we are with the most intense part of this project, really, which has been to create a culturally competent maturity matrix that enables organisations, regardless of whether you're a provider, commissioner, ICP partner, wherever it might be, to affect the change that's required. And we recognise that not one of these principles will affect change in their own right, but collectively then they can have an impact. So we've got the equality assessment, community engagement, inclusive decision making. If I just focus on that for a moment, that's all around that diversity of thought and that the inclusion of multiple perspectives is required to break current patterns in thinking and behaviour. As we've described, there's a lot of historical challenge here, so we need to do things differently, and by getting different people from the different protected characteristics, different cultures, religions, but also importantly different perspectives on and professional knowledge and understanding about how things might change can all help to affect the change that we need to. So there's the representative workforce, accountable leadership, data and evidence, and the financial investment. And so what the maturity matrix does, it lays out from emerging through to thriving over 4 domains where organisations can use it as an assessment tool in terms of where they're at, what the aspiration is, and what steps you might need to take to get to that. So the maturity matrix will be used by ICP partners, community organisations to help on that journey to develop into being a culturally competent organisation, which will help to address some of the health inequalities that we're striving to achieve. So if we go to the next slide, Clive. So where do we go from here? As I say, maturity matrix has been developed by the ICP steering group over a year, and it was presented to the executive ICP executive group, and we've got some great additional feedback and opportunities about implementing it and how we can do that successfully, and that's the bit that we will be looking at moving forward. We need to get that final refinement from the ICP steering group, which we are going to get achieve in April, and then look at running and piloting the maturity matrix with a commissioner and a provider, just so that we can sense check and refine it further. At that point, we will be looking at how a strategic implementation plan, which we recognise is a really challenging part of this project. We don't want this to be a tick box exercise. There's a lot of work that's gone into this, and what we need to do is ensure that organisations, individuals have as much time invested as we put into creating it, so that it's really effective and create some of the change that we need to. And to underpin that, we will be developing guidance and which will go alongside a resource bank to enable not only to create opportunity to get over some of those challenges, but really importantly to celebrate where we've got successes and to share good best practice as well. And as I've put at the bottom, that the journey continues. This is a forever journey. There's lots of work and refinement that will happen. As Clive laid out the landscape, we've got a great opportunity to affect that change, and we want to continue with the pace that we've created so far. So at this point, we'll come to an end and are open for questions. Thank you.
Many thanks to Clive and Donna for that presentation and for all of the work that you've undertaken as part of leading this programme. Just a reminder to everyone to post your questions into the Q&A section. I think there's a chat box and a Q&A box, so if you can post them into the Q&A box, that would be really helpful. So we've got a couple coming in. Just going to start off, Donna. We've got Donna to answer the questions now. So first of all, you talked a lot about co-production, the importance of co-production during the presentation. I'd be interested to know what it's been like working alongside ICP partner organisations, representatives from those organisations, but also representatives from the communities, and what you think the sort of strengths and perhaps some of the challenges have been in doing that.
Yeah, thanks, Rich. It has been a really interesting journey, and I think I'd had an experience a few years ago where we'd done a session called Who Shoes, which was looking at, it was about maternity at the time, and looking at how different people experience the same situation. And I think that's been the beauty really of coming together, as you said, and or as Clive said, senior leaders across the ICP with the community members talking about and community organisations talking about the challenges for the same aim and the same focus. And I think we've had some really strong learning points, and I think the beauty of that has been, and what you get from that co-production is that it's equal voice, and therefore there's equal learning, and then you start to build trust and people get a bit more comfortable to ask or share uncomfortable you know, challenges, experiences, and then that's where you get some of that, as you know, we worded it as that culturally mature conversations, and how you can start to sort of stop talking about what's gone wrong and start looking at how we can start to move, you know, some of that forward, which has been a really difficult space. I think, you know, in the early days we were quite often asked, what is it we need to do to make a change here? And I don't think any one person has the answers. I think the conversation, the development, and continually looking at things that we've all done for years, systems that have been there for years, reviewing them with a different lens and being supported by colleagues, organisations, policies and procedures to question why is it always done that way, and how can we use our knowledge and experience to make some of those changes moving forward. So the co-production element has been equally inspiring, knowledge sharing, as it has been challenging at times.
Thank you, Donna. And we've had some getting lots of kudos in the chat. Alongside it, Hugh's posted a question here, which is a good one, which is about, this is not just a Nottingham City specific issue, is it? And Clive introduced that at the beginning of the presentation. So have you got any thoughts about how we could potentially spread this beyond the City ICP, and Hugh's suggested here on the ICS and even beyond into other organisations in the city?
Yeah, I think that they're all great ambitions which would enable us to really affect that change, because this is one of those things where it could just happen in a moment of time and then sort of dissipate over time. And I think that is a great ambition. But the most important thing for that credibility and for that engagement is that we test and learn from what we've got at the moment, so that we can give that expert knowledge and experience to others. I was on in a meeting earlier in the week, and we were talking about the importance of, you know, sometimes we have time to invest in things or additional money, and for different projects you might not always have that money moving forward, or you might not have that resource, but what you do with the learning is it enables you to make it easier for somebody else or cheaper for somebody else. And I think that's what you know, the ambition of this piece of work is, let's try and get it as to the stage where it's as solid and we know as much about it as we can at this point, so then when we do start to scale up share, that it helps others, and you know, and be that little bit easier.
That's brilliant, thank you, Donna. There's a couple of questions in here about the use of a maturity matrix tool, so not quite familiar to terminology for everyone, although I think you did a good job of explaining that within the presentation. So Claire's asked a question about, is this a tool that organisations will use as a way of sort of self-reflecting, and do you envisage partner organisations identifying areas that we can collectively move together forward on as a partnership?
Yeah, so a maturity matrix is there, is it's strength based. So you've got the you know, you move through from emerging 3 to 5 thriving, so there's 4 domains there, and what it allows you to do is to be open and honest. So yes, it's a self-reflection, self-assessment tool about where you're at. It allows you to then see what's achievable. You might never get to thriving, but you know what the aim is towards that, and I think it allows you to put those steps in place to make what can feel like an overwhelming responsibility, to make that feel achievable by the, you know, steps along those lines. So the maturity matrix is there to enable achievable change, and yes, you will then be able to say, actually we can't do all 7 principles, but we're going to focus on 3 of them, and one of them we're really strong on and we want to develop even further. The other one actually we're really emerging, and we've got a lot of work to do to move to the next phase. So it's there to enable change rather than an exercise that sort of leaves you feeling like you don't know where to start, or that you're not going to be able to affect any change.
Thank you, Donna. We are close to running out of time, but I wonder if I could just ask you one final question, which is, we've talked about organisations having a self-reflective tool. I wonder if I could ask you a personal self-reflective question, Donna, about what it's been like for you personally to lead this programme.
Yeah, it's an interesting one, because when this first came, this opportunity came to light, it was actually really empowering for me, because I remember way back at the beginning of COVID, when we were hearing about the all of the challenges from a COVID perspective for BAME communities and the, you know, Black Lives Matters, I sort of sat there with my head in my hands thinking, where do we go? This is just overwhelming, almost in an awakening moment of, I can't be passive in this, I need to do other things. And I remember watching a presentation from Dr. Williamson, who spoke about all of the challenges that BAME communities face, and then he had a slide which actually I've just checked in my diary, and it's called the slide of hope, because it spoke about the things that you can do to make that difference. So personally, I was looking at something that I could do within my main job, but also outside of that, and I think that this has enabled me to, you know, have that passion and to share and to learn massively in the last 2 years from all of the inspiring people that I've worked with, the different reports that I've read, different experiences that I've had. And yeah, that has enabled me to continue with having some of those collaborative and challenging professional and personal questions. And I think this is one of those things that it isn't about, you know, your professional life, it goes into your personal life as well. So yeah, it's been challenging and rewarding in equal amounts.
That's fantastic. Thank you, Donna, and thank you for all of your efforts in leading this programme as well. There's some other comments in just saying what wonderful work. So others are agreeing too. But we've come to the end of time now. So Donna, thank you very much for this afternoon, and thank you everybody for tuning in for the session this afternoon. This is the final Share and Learn in this series, although not the final one. We're just currently putting together a programme for the next series. So keep an eye out for that. There'll be an announcement on that soon. But thank you again for joining us this afternoon, and have a good rest of your day. Thank you.